Thank you for joining me. Today we're going to be doing the Hether Macro through Chirotouch Impairment Rating with the American Medical Association 6th edition book, The Guides to Whole Body Impairment. So right now we've put down that today we're doing an evaluation, which is a final impairment. This is a person that has neck pain that was rated 2 out of 10, that he has about 2 days a week without radiation. He also has upper back pain that is rated 1 out of 10, and he has this 1 day per week. He has some aggravating factors, such as sitting for more than an hour bothers his neck, some palliative factors, such as changing position, chiropractic treatment, and heat. And with this exam, he has no new changes of the review of systems. We also put down for this examination that we did the vitals. We also took ranges of motion for the neck and the upper back. And we also did some reflexes, which indicated normal reflexes on this individual. The orthopedic test showed that he had normal grip and that lifting up of the head did relieve some of his tension. He's tender at C2 and C3. And we also reviewed his MRI that was taken back in April that said he has a bulge disc between C2, C3, and a herniation between C4, C5. So we have our diagnosis already here with a complaint of non-radicular neck pain related to a motor vehicle accident that happened back in March. His status was acute, being that we are working within the first 6 months of care, almost subacute, but today we are going to change this by deleting his status and changing his status to, at this time, the patient has reached maximum medical improvement. With that said, the prognosis, even though it's good to fair, we're going to be changing. And when we change or delete something on the iPad with Chirotouch, you simply pull up your keyboard, take 2 fingers and put it on, for example, the R and the Y. The keyboard disappears, and then you simply drag down and hit backspace to delete. So the prognosis for this individual, being that they are reached maximum medical improvement, is not likely to change in any significant degree over the next year. And as we anticipated an impairment rating for this individual, but we couldn't give one at the previous dates, now we can. So we're going to go into the impairment rating section, and we're actually going to introduce it. That says, as of today, we're going to do it. And it also mentions here in the guides that most doctors, including chiropractors, are allowed to use this book. So that's kind of nice for us. So we have the impairment rating for spine, which is chapter 17 in the guides. And we're going to work with the cervical impairment. So the cervical impairment, for this one, he does have a disc herniation. So we call that a motion segment lesion. And with this motion segment lesion, he has a category class of 1. His functional outcome assessment score was 50, which places it at a scale of 1. And his physical findings was a positive 2 because the orthopedic test lifting up on the neck did relieve his neck pain. And we cannot use his diagnosis for his clinical studies because we are using the impairment rating herniated disc or motion segment lesion, so this makes this classification not valid. So this moved it from a, he was a 1 and 2 makes 1 and 1 and 1, 2 makes, so it goes from a 0 to a +2. And if we look at the guides, a C impairment is a rating of 6, and that moved it to an E. So the previous C was a 6, and that moves him to an 8% whole body impairment for the neck. And again, his clinical, his functional history factor was 1 because his functional outcome assessment score was 50 using the pain disability index. His physical findings was +2 because positive orthopedic test. And again, this clinical factor was not valid. Good. So from there, we can do the thoracic impairment. And for this one, it's very simply, it's a soft tissue injury. His thoracic class was 1. His score was 40, which still gave him a 1. And there was no real physical findings because I didn't do any orthopedic tests on the thoracic, so that makes it not valid. And he actually had normal x-rays. So if we do the math, 1 minus 1 and 0 minus 1 is a -1, which actually pulls the C value to a B value, and that actually moves the 3% impairment to a 2% impairment. Very good. And again, we said that was a 1 based on his score was 40 for his functional outcome assessment. The clinical factors were 0 because of the normal x-rays. And then we can simply add it up. We can look right here that he has a 2% whole body impairment for the thoracic, and he has a 8% whole body impairment for the neck. And combining low numbers is almost the same as adding, even though combining and adding are different. There's an actual chart that you can see. 90 plus 90 can't equal more than 100. So the higher the numbers are, the lower the math works. It's kind of silly, but there's a graph for it. So we have one here for cervical and thoracic. And we said that the cervical was 8 and the thoracic was 2, giving him a 10% whole body impairment. And again, this is not based on my assumption. This is actually according to the guides. It talks about how it was taken, how everything was done within that findings, and that chiropractors can utilize this. So the only thing we have left now to do is for our plan is we did an exam. We actually adjusted this individual on the same day with a Gonstead technique, and he's to come back as needed. However, we can also go under the exam findings saying that at this time, he has reached maximum medical improvement. His initial visit was back in March. It was like a day or two after the accident. So let's put that down as the 21st. And that as of today's date, he has reached maximum medical improvement from a motor vehicle accident, sustaining a 10% whole body impairment. So there's our conclusion. And I wanted to reiterate, it's not an opinion-based impairment rating. It is a factual-based impairment rating that any other doctor using the same exact book would get the same exact diagnosis. Thank you for watching, and if this is something that could benefit you in your office, as far as the ease of doing an impairment rating, give my office a call at 386-734-0702. I'd be happy to talk to you about more of how the Hether Macro can help your practice. Thank you. Bye-bye.